We wrote our scientific research paper on the relationship between hippocampal volume and normal aging by Elizabeth Paulson and Peyton Hairston.
To understand what hippocampal atrophy is, we have to understand what the hippocampus is. The hippocampus is part of the limbic system of the brain, the part of the brain that regulates our emotional and behavioral responses. The hippocampus contributes to learning and memory as well as emotion. There are usually two types of memory that are formed by the hippocampus: an episodic memory and a somatic memory. An episodic memory is a memory that has overlapping features or information that can be different each experience. For example, if one of your neighbors has an aggressive dog and the other does not, you will remember which dog to be more careful of. Then there are somatic memories. Somatic memories are geared more towards generally knowing something without having to experience it. Another example for a somatic memory would be dogs go outside to use the bathroom and run around. Some dogs like to be petted while others do not. So it makes sense to always remember to ask the dog owner if you may pet the dog. That is a somatic memory. Now that we know what the hippocampus is, we can try to understand what hippocampal atrophy is. Hippocampal atrophy is a form of brain damage that affects memory and navigation. Hippocampal atrophy is the degeneration of the hippocampus. People who experience hippocampal atrophy also have symptoms of memory loss, disorientation, as well as not being able to complete a task that might have been easier to complete before the shrinkage of the hippocampal volume. As the hippocampus begins to shrink, some people may also see changes in behavior as well as social and professional withdrawals.
What causes hippocampal atrophy? Well, as our hypothesis was supported, normal aging, so it happens to everyone. Alzheimer's disease and dementia also cause it. Many psychiatric diseases, hypertension, Cushing's disease, even genetics and lifestyle, especially alcohol and stress, are both associated with hippocampal atrophy. The vulnerability of the hippocampus has not been fully explained, nor have the biological mechanisms that might play a role in causing it to shrink.
How can we slow down hippocampal atrophy? There is no way to truly stop hippocampal atrophy. This is because it is normal as people begin to age. However, there are ways that can help strengthen your hippocampus. By having a healthy lifestyle, such as exercising, eating healthy, and challenging your mind, studies have shown that people can do these things and have a higher brain longevity. However, scientists are doing studies on a medication that has shown promise to help slow the decrease in volume of the hippocampus. This medication is known as ibudilast. At the moment, ibudilast is used to help treat multiple sclerosis.
Why is it important for us to understand hippocampal atrophy? Well, as we found out, it happens to everyone. From the discovery of its role in episodic memory following bilateral resection in hippocampus to the discovery of its role in symptoms of Alzheimer's disease, the hippocampus is considered a structure fundamental for human cognition. In addition to its well-documented role in memory function, recent research demonstrates that the hippocampus also plays a role in executive function, processing speed, intelligence, path integration, and spatial processing. Each of these cognitive processes is shown to decline in the context of cognitive aging. Understanding how change in hippocampal structure impacts cognition in the context of aging and may prove important for identifying critical neural underpinnings of the cognitive aging process and intervention targets for combating cognitive aging. The research should be continued because the relationship between cognitive aging and hippocampal structure in the absence of disease remains relatively understudied. Hippocampal volume is considered to be a useful way to measure disease burden and progression in Alzheimer's disease. These findings demonstrate that hippocampal volume estimations have the potential to provide important information to assist diagnosis, risk stratification, and possibly even monitor the effects of intervention. However, several key challenges in the processing, analysis, and interpretation of structural MRI scans outside of research setting have far prevented this method from being used in standard clinical practice. Second, hippocampal atrophy has not only been described in pathological but also healthy aging. A meta-analysis estimated the average yearly rate of hippocampal atrophy at 1.4% in healthy aging and 4.7% in Alzheimer's disease. Thus, in order to reliably categorize a patient's hippocampal volume, clinicians and researchers require access to age-related normative percentiles to distinguish between healthy and pathological aging. Few studies have attempted to provide such normative values, or not least because of methodological obstacles. Basically, the more knowledge we gain from research of the hippocampus means improving quality of life for suffering people and ultimately saving lives and curing diseases.